Hello, welcome again to HRSCO Online, your online resource for information on custom foot orthotics, custom molded shoes, AFOs and prosthetics. In this session, we're going to take a look at the Richie Brace. The classic symptom or diagnosis for the Richie Brace is considered to be posterior tibial tendon dysfunction, or PTTD. That's where there's been strain or inflammation of the tibialis posterior. The Richie Brace is also used for other diagnoses such as ankle instability, sinus tarsi syndrome, and in certain cases of degenerative arthritis, where you're trying to control the motion at the ankle for the patient. This is an example of the classic Richie Brace style. It has a single pivot, so you get a hinge motion. This allows dorsiflexion to occur. It's built on a custom foot orthosis with a very deep heel cup, 35 to 40 millimeters, something akin to the UCBL, and it's given a soft cushioning top cover that extends usually to the sulcus but can go full length, assuming that there's room in the shoe where the shoe has a removable inlay. I see the Richie Brace as being an excellent choice to treat the diagnosis that we mentioned, but you should consider it along a continuum of various devices depending on how much control you want and also depending on patient considerations such as their weight or activity level. The heavier the patient, the more control you will need. Patients tend to like the Richie Brace because it fits well inside their shoe. Certainly if they're going to wear boots with removable inlays or sneakers, there's room to take out the sock liner and put the brace in there. There are other models or adjustments that are possible with the Richie Brace. The classic is made with a single pivot at the ankle joint. That's why it's important to mark the lateral and medial malleoli when you take the cast. In addition, tamarack joints can be used either for free motion, but also to have a dorsi assist effect where the foot is raised. This is excellent for patients who have drop foot or post-stroke patients who need a little more control and help with ground clearance during gait. Other modifications for the Richie Brace can include a double pivot where you want to restrict motion of the foot plate in relation to the lower leg. And there's also arch suspenders, either medial or lateral arch suspenders, that can be used to provide extra control and pull up the foot into a more normal position to improve their function and reduce pain. In the short video that follows, you'll see an example of a patient wearing a Richie Brace. Initially you'll see the before shot with the patient barefoot, and then you'll see them walking with the Richie Brace on. Although there may not be much visible difference in the function of the foot, the application of the AFO can make a tremendous difference to the patient, both in terms of providing comfort and reducing the pain during ambulation, so they will be more likely to walk, but also it will prevent further deterioration or degeneration of the ankle joint and the foot itself. Thank you once again for joining us at HRSCO Online.